Welcome to the first section of your NREMT exam prep course. Focusing on preparatory, EMS operations, and patient assessment. In this module, you will learn the fundamental rules of emergency medical services, from ensuring scene safety and understanding legal boundaries, to performing a comprehensive patient assessment. These topics are incredibly important because they form the operational blueprint for every single call you will run as a certified EMT. I am excited to guide you through these core concepts, as mastering them will give you absolute confidence on exam day and in the field. Let us get started and build a solid foundation for your EMS career. To set yourself up for ultimate success, I highly encourage you to obtain our practice tests or download the offline app, which are excellent educational tools to guide your study journey from day one. The very first step on any emergency call is the scene size up, which begins the moment you are dispatched. Before you ever touch a patient, you must evaluate the environment for hazards, such as traffic, downed power lines, or aggressive bystanders, to ensure your own safety and the safety of your partner. The NREMT exam will heavily test your commitment to scene safety, often tricking you with options to treat the patient immediately. But you must always remember that scene safety is your top priority. During this phase, you also determine the mechanism of injury or nature of illness, count the number of patients, and request additional resources if necessary. Closely tied to scene safety is the concept of body substance isolation, commonly referred to as BSI, and the use of personal protective equipment, or PPE. As an EMT, you must assume that all blood and body fluids are infectious, which is a concept known as standard precautions. On the exam, you will frequently see questions where donning gloves and eye protection is the first correct action before patient contact. Wearing the correct PPE protects you from communicable diseases and ensures you remain healthy enough to help others throughout your career. Understanding medical and legal concepts is vital, starting with the principle of consent, which is the permission a patient gives you to provide care. Expressed consent occurs when a conscious, mentally competent adult verbally or non-verbally agrees to your treatment. Implied consent, on the other hand, applies when a patient is unconscious, confused, or severely injured, allowing you to legally assume they would want life-saving help if they could ask for it. Exam questions love to test the boundaries of implied consent, especially in cases involving drug overdoses or severe head trauma where the patient is altered. A competent adult always has the right to refuse medical care, even if that refusal could result in their death. To legally accept a refusal, you must ensure the patient is fully oriented to person, place, time, and event, and that they are not under the influence of drugs or alcohol. You must clearly explain the risks of refusing care, up to and including death, and document this conversation thoroughly on your patient care report. The NREMT exam will often present a stubborn patient who needs care, and you must recognize that forcing treatment on a competent adult is considered battery. Negligence is a critical legal concept that occurs when an EMT fails to provide the standard of care, resulting in harm to the patient. For negligence to be proven, 4 elements must be present, which are a duty to act, a breach of that duty, actual damages or harm to the patient, and proximate cause, meaning your specific action or inaction directly caused the harm. A common mistake candidates make is confusing simple mistakes with negligence. But remember that all 4 elements must be legally met. Understanding this concept protects you from liability and ensures you are always acting in the best interest of your patient. To get a feel for how these legal definitions are framed on the actual test, jumping into the practice tests or reviewing with the offline app can be incredibly helpful for your prep. Patient confidentiality is strictly protected by a federal law known as HIPAA, which stands for the Health Insurance Portability and Accountability Act. This law means you cannot share any protected health information with anyone who is not directly involved in the continuing medical care of the patient. For example, you can share a patient chart with the triage nurse at the hospital, but you cannot discuss the patient details with your friends or post about the call on social media. Exam scenarios will test your ability to recognize legal sharing versus HIPAA violations. So always guard patient privacy closely. Proper lifting and moving techniques are essential to prevent career-ending back injuries, which are unfortunately common in emergency services. You must always use your leg muscles. Keep your back straight, and hold the patient weight as close to your body as possible, utilizing the power grip whenever you can. Emergency moves are only used when the scene is immediately dangerous, such as a vehicle fire, while urgent moves are used when the patient has a life-threatening condition requiring rapid extrication. The certification exam will ask you to differentiate between these types of moves based on the safety of the environment and the patient condition. Effective communication is the lifeline of EMS Operations, linking you with dispatch, medical direction, and receiving hospitals. When giving a radio report, you must be concise, accurate, and professional, painting a clear picture of the patient status without revealing their name or violating confidentiality. You should use standard medical terminology and avoid slang or unapproved abbreviations to ensure clear understanding across different agencies. Knowing how to communicate effectively ensures the hospital is fully prepared for your arrival, especially for critical trauma or stroke patients. The patient assessment sequence is the core framework of an EMT, and it begins with the primary assessment, which is designed to identify and treat immediate life threats. As you approach the patient, you will form a general impression, noting their age, sex, level of distress, and overall appearance before you even speak to them. This quick visual scan dictates how fast you need to move, and whether the patient is considered sick or not sick. The NREMT exam heavily emphasizes the primary assessment, because missing a life threat here will lead to poor patient outcomes. Immediately after your general impression, you must assess the patient level of consciousness, or LOC, using the AVPU scale. AVPU stands for alert, verbal, painful, and unresponsive, which allows you to quickly categorize the mental status of your patient. An alert patient tracks you with their eyes, while a patient responding to pain might only groan when you rub their sternum. A dropping AVPU score is a major red flag for declining patient stability, and is frequently used in exam scenarios to indicate a worsening condition. Once you determine responsiveness, you move to assessing the airway and breathing, prioritizing these above all else. If the patient is talking to you normally, their airway is open. But if they are unconscious, you must manually open the airway using a head tilt chin lift or a jaw thrust maneuver. You then assess the rate, rhythm, and quality of their breathing, intervening immediately with oxygen or artificial ventilation if they are breathing too slow, too shallow, or not at all. Exam questions will constantly challenge you to fix airway and breathing issues before moving on to any other part of the assessment. Following airway and breathing, you must evaluate the patient's circulation by checking their pulse, assessing their skin, and controlling any major bleeding. In conscious adults, you check the radial pulse at the wrist. But in unconscious adults, you must check the carotid pulse at the neck to see if the heart is still pumping adequately. You will also assess the skin color, temperature, and condition, looking for signs of shock like pale, cool, and clammy skin. If you find severe arterial bleeding, you must apply a tourniquet immediately, as stopping massive hemorrhage is the only exception to the traditional airway, breathing, and circulation order. The final step of the primary assessment is making a transport decision, which categorizes the patient as a high priority or a low priority. High priority patients include those with severe pain, altered mental status, difficulty breathing, or unstable vital signs, requiring immediate transport to the nearest appropriate facility. Low-priority patients are stable and can usually be assessed further on scene before starting the drive to the hospital. The exam will often give you a list of patient presentations and ask you to identify which one requires rapid transport. Testing your triage abilities. After the primary assessment, you transition into history taking, using the sample mnemonic to gather essential medical information. SAMPLE stands for signs and symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the incident. This tool provides a comprehensive snapshot of the patient background, which often reveals the underlying cause of their current emergency. For example, knowing a patient took insulin but missed lunch perfectly explains their altered mental status, a deduction you will frequently need to make on your exam. When assessing a specific symptom, particularly pain or shortness of breath, you will use the OPQRST mnemonic to dig deeper. This stands for onset, provocation, quality, radiation, severity, and time, helping you characterize exactly what the patient is feeling. Asking if the pain radiates to the jaw or arm can help you identify a potential heart attack, while asking about the onset time dictates specific hospital treatments. Mastering OPQRST allows you to paint a detailed clinical picture for the receiving doctor, and helps you select the correct protocol interventions. The secondary assessment is a more thorough head-to-toe physical examination designed to find injuries or conditions that were not immediately life-threatening. For a trauma patient, you will palpate the head, neck, chest, abdomen, pelvis, and extremities. Looking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling, collectively known as DCAPBTLS. For a medical patient, the secondary assessment is usually focused only on the specific body system related to their chief complaint. The exam will test your understanding of when to perform a rapid trauma assessment versus a focused medical exam based on the mechanism of injury. Obtaining a baseline set of vital signs is a crucial part of your assessment. Providing objective data about the internal status of your patient. A complete set of vitals includes blood pressure, heart rate, respiratory rate, oxygen saturation, and blood glucose levels. You must not only know how to obtain these numbers accurately, but also understand the normal ranges for different age groups, as the NREMT will expect you to recognize abnormal findings instantly. Comparing baseline vitals with subsequent sets allows you to track trends, showing whether the patient is improving or deteriorating under your care. The final phase of patient care is the reassessment, which is a continuous process performed while en route to the hospital. During this phase, you repeat the primary assessment, recheck vital signs, evaluate the effectiveness of your interventions, and monitor for any sudden changes in the patient condition. A stable patient should be reassessed every 15 minutes, while an unstable patient must be reassessed every 5 minutes. The exam will frequently test this timing rule, ensuring you understand the importance of vigilance during transport. I want to congratulate you for completing this first section on preparatory, EMS Operations, and patient assessment. I highly encourage you to complete the attached practice tests for this module, or fire up our offline app, as challenging yourself with realistic questions is the best way to improve retention and exam readiness. You will find that the practice tests and offline app are included with this lesson to help you actively reinforce everything we just covered. Keep up this excellent momentum and active learning approach. And I naturally look forward to seeing you in the next section where we will tackle the critical world of airway management and respiration.